Next panelist is Dr. Shlomo Mendlovic, who will talk about Traumatized multiple selves, society and a curative potential of truth and reconciliation commission. A few words about Shlomo. Wait a minute, Dr. Shlomo Mendlovic is a psychiatrist heading the department at Shalvata Mental Health Center nearby Tel Aviv. He is the acting chairman of the Tel Aviv University Program for Psychotherapy. Together with a close circle of students, Dr. Mendlovic has initiated a socially ordered multiple selves model of the mind. The book summarizing this model was published in Hebrew on the social order of the multiple self in 2009 and in Italian, L'ordine sociale dei multipli thank you. Published in 2008. Currently, he is working on a book that elaborates on the clinical and technical aspects of this model.
Okay, thank you very much. During the past 20 years, psychoanalysis, and relational psychoanalysis in particular, has shifted from a unitary perception of the psychic world to its perception in terms of multiplicity. During the mid-80s, in the light of the works of Winnicott and Heinz Kohut, the true or nuclear self has become central to any psychoanalytical discussion. The role of the analytic process was then to expose this true self, to validate it, to vitalize it, and to allow the patient to connect to it, by this achieving authenticity and acquiring a sense of meaning. The hyper-contextual atmosphere of the 80s and 90s in Europe and in the United States, or mainly in the United States, brought a fundamental change. Instead of aiming at a nuclear, definitive self, psychoanalysis has initiated the exploration of the human psyche in terms of multiplicity. Instead of referring to one solid, true self, psychoanalysis conceptualized the psychic space as inhabited by multiple selves, each containing its own specific set of hopes, of dreads, defense mechanisms, and fantasies. Specific effort is presently invested in exploring the rules by which the various selves are related to each other. One appealing option is to think of the multiple selves as organizing in a social order. If indeed each of the multiple selves stands by its own, the same way each individual stands by his or her own, it is conceivable that the relations between the multiple selves will be governed by the same rules managing the interactions between human beings. By this, we state that the multiple selves are socially related to each other. And so, in a nutshell, the multiple self approach explores the psychic space as a community of selves. Nowadays, our research group at the Tel Aviv University, the Tel Aviv Laboratory of Psychoanalysis and Cultural Studies, deepens its understanding of the various social processes occurring in between the multiple selves. This group includes exceptionally excellent second and third degree students, psychiatrists, psychologists, social workers at the School of Psychotherapy here at the Tel Aviv University, highly experienced clinicians from Shalvata and other mental health centers in Israel, and of course experts in the field of cultural studies, sociology, and related areas. I would like to evoke some of our thoughts of how the socially decoding of the multiple self-society of the traumatized patient could provide new insights into developmental, psychopathological, and interventional aspects of the psychic world. This presentation is based upon the work of Ido Tamari, to whom I would like to thank. Trauma is associated with dissociative defense mechanisms as well as dissociative symptoms, either as isolated, as in derealization, or aggregated, as in acute stress disorder. Due to time limitation, I will not dwell on the dissociative elements associated with the trauma or with normal development, but rather refer you to the works of Philip Bromberg, whose Standing in the Spaces Essays on Clinical Process, Trauma and Dissociation from 1998 and Awakening the Dreamer, Clinical Journeys from 2006, have directly addressed those issues. For our purposes, let us think of the traumatized patient in terms of a split society of multiple selves. While in health, the intrapsychic field contains multiple selves that communicate with each other, in unresolved or yet unresolved trauma, this field contains multiple selves that are segregated, situated in a vertical split that keeps them apart from one another. Such a split society of multiple selves, in which traumatized and no traumatized sets of multiple selves are unable to communicate with each other, is unable to create a cohesive testimonial narrative, thus further fragmentating the intrapsychic. Ido Tamari, who was a student at law school at that time, extensively studied the Truth and Reconciliation Commission during his studies, and during our joint work at the seminar brought up a brilliant idea. The TRC, this Truth and Reconciliation Committee, is a tool designed to allow a discourse in a society that underwent a malignant process of splitting, and thus lost the ability of establishing a free internal dialogue. The TRC is thus aimed to initiate, to promote, and to monitor dialogue in such societies where trauma has muted any possible conversation. And if so, continued Ido, it is possible to suggest a preliminary provocative idea, to apply the concept and technique of the TRC to the traumatic and dissociated patient. The Truth and Reconciliation Commissions were court-like restorative justice bodies assembled in South Africa after the abolition of apartheid. Witnesses who were identified as victims of gross human rights violations were invited to give statements about their experiences, and some were selected for public hearing. Perpetrators of violence could also give testimony and request amnesty from both civil and criminal prosecution. The TRC was seen by many as a crucial component of the transition to full and free democracy in South Africa. Despite some or even many flaws, it is generally, although not universally, thought to have been successful. In its sense, the TRC's emphasis on reconciliation is a sharp contrast to the approach taken by the Nuremberg trials after the World War II and other denazification measures. Because of the perceived success of the reconciliatory approach in dealing with human rights violations after political change, either from internal or external factors, other countries have instituted similar commissions, though not always with the same scope or the allowance for charging those currently in power. The success of the TRC method versus the Nuremberg method of prosecution is open to debate. Yet, this TRC method was considered by Ido, as well as by many other members in our seminars and in our research group, to be highly relevant to the treatment of patients afflicted by severe trauma. When a society, either an actual society or a multiple selves society, which is embedded in the individual, becomes the target of violent attacks, the group under attack is forced to deal with 5 psychological phenomena. The first is common sense of shame, humiliation, dehumanizing guilt. The second is inability to be assertive. The third is partially or complete identification with the aggressor. The fourth, difficulty and an inability to mourn the loss of the past or to trust good human nature, and replication and reproduction of the trauma. These social responses are taken from socially bound studies and not from the psychological arena. If you will examine these five phenomena, you will easily find them of direct relevance to both societies and patients exposed to severe trauma. The traumatic patient's intrapsychic sphere is inhibited by experiences of shame, humiliation, dehumanizing guilt, is unable to be assertive, heavily identifies with the aggressor, what we know as the Stockholm Syndrome as the pronunciation of this, loses the ability to mourn and reproduces the trauma on experiential and emotional levels. The TRC were aimed at converting revenge by discovering the truth and achieving a state of acceptance, closure. The basic procedure was that of storytelling, of giving a testimony in front of a commissioners. Many of the victims experienced the process itself as cathartic, even healing. They spoke of how it was important to forgive those who committed the crimes against them, and at the same breath experience this forgiveness as the first step to recovery and building constructive life. It is therefore conceivable that the very effect of the TRC was similar, at least in part, to that of debriefing. It is important to note that not all the victims who testified shared that sense of therapeutic experience. Some felt that the committee was aimed at achieving communal goals while neglecting the individual. However, our interest in the seminar, in our work, our interest was not in the effect that TLC has on the individual, but rather on the collective, as we are referring the traumatic patient as collective multiple self society. For us at the laboratory and on the seminar, the traumatized patient is a society that underwent a malignant process of vertical splitting. Our conceptualization of the traumatic patient is that of a dissociated society in which adjacent areas contain selves that are unable to communicate with each other. And the treatment we would like to initiate does not deal with any of these parts, but rather with the relations between them. Ido's idea to apply a TRC model on the traumatic patient was therefore aimed at reconstituting a new order, to rearrange the relations between the dissociated clusters of selves. The committees were not aimed at relieving the pain and the agony of the individual, but at allowing reconciliation, healing, acceptance, and empowerment of the society rather than revenge. Respectively, Ido's suggestion to apply the TRC to post-traumatic patients was not aimed at attenuating the victimized selves, but rather to allow them to live in peace with the society of selves contained in the patient. In order to meet its mandate, the TRC constituted a unique methodology. This methodology was aimed at initiating, coordinating, and facilitating the gathering of information and the receiving of evidence from any person, including persons claiming to be victims of violations, which established the identity of the victims of including persons claiming to be the victims of violations. The modus operandi of the TRC gave very little guidance to how the committee's function were to be performed. While this gave the freedom and flexibility to develop appropriate systems and staffing structures, it also posed a tremendous challenge. In my clinical practice, I have re-evoked the TRC practice to the arena of psychotherapy. Very briefly, such a TRC-guided psychotherapy conceptualized the traumatized intrapsychic sphere as inhibited by multiple selves many of which are associated with the trauma. The first phase of therapy was associated with identifying this diversity of the selves. Based upon transference, countertransference, and mainly projective identification, we, the patient and I myself, positioned the multiple selves and related them to each other. By this, conflicts were exposed. Referring to the previous lecture of Professor Lieblich, think, for example, about this very important question, who is the teller? Who tells the story? In such a multiple self society, who is the self that gives the narrative of the whole person? Then the TRC-like process was initiated. This process of exposing the emotional truth of both the victimized and the victimizing selves of the patient allowed them to reconcile, and this is not a simple task because sometimes, as you can see, there is a great gap between truth and reconciliation. But when this happened, this process helped the patient to integrate together the non-communicating selves, to open a vital discourse, and to discuss the very 5 aspects that typifies traumatic societies: common sense of shame, humiliation, dehumanizing guilt, inability to be assertive, what I showed before, partial or complete identification with the aggressor, difficulty and an inability to mourn, and replication and reproduction of the trauma. Technically, how this was done. Technically how this was done. There is something about the nature of trauma itself that promotes this process. Trauma is adhesive in nature. It tends to stick to people who come in contact with it. When the patient shares the therapist the traumatic experience, certain affects and fantasies are transmitted to the listener, which is the therapist in our instance. The patient transfers the conflict to the therapist, entangling the therapist in the split he or she, the traumatized patient, carries. But the therapist is more aware and, generally speaking, more capable to deal with such a malignant split. Nelson Mandela, in his Nobel speech in 1994, encapsulated this process in which the therapist is doing for the patient a job that the patient cannot do by himself, this reconciliation job, by saying, as we are liberated from our own fear, our presence automatically liberates the others. And by this I'm trying to say that when the therapist is capable to liberate himself from this split, he is capable to liberate also the other, also the patient. And so, when the therapist reconciles his own non-communicating aspects, the patient will follow this process. But this technical issue, as it seems, deserves another lecture. Thank you very much.
Thank you very much, Dr. Shlomo Mendlovic. If you have questions, I think we were presented by a very novel and new approach to the issue of trauma. Anyone? Yes, please.
Yes, I would like very much to have some light on your theoretical background, which allows you to conceive the self as a metaphor for a kind of society. I'm very impressed by your purple and green shimmer, but I found it highly metaphorical.
I think this deserves... For the past 5 years, we have so many discussions about this question, whether something is metaphorical, analogical, or somewhere in between. We do think that in psychotherapy, many times we are using metaphorical things. Also, the term self is metaphorical in its sense. So the same question can be directed towards, I think, any aspect of any psychological, psychoanalytical grounded therapy. And I think that what is difficult here is to think about the self in terms of multiplicity, and to perceive the fact that such multiplicity can be governed by social rules. I must admit that this is not our own idea. I mean, current psychoanalysis, especially in relational psychoanalysis, thinks about the self, about the intrapsychic sphere in such terms. It gives rules and structures which are very similar to what is given in sociology. So we don't see this leap as such a critical one, but I think it can be discussed thoroughly. I agree with you.
Thank you. Any more, please? Nomi?
I wanted to ask about your conception.
Please speak up.
Your conception of the self as the sort of end product of therapy. Would it be more a case of still multiple selves that are somehow allowed to live in cohesion with the community has been reconciled, but they're still separate entities, or more of a single entity with multiple facets that are more unified?
The first option. We think so because we decode intrapsychic sphere in this.
The conception of the self is not that it can ever be unified.
Exactly. We think that a unified, totally unified self is death, because life is being burdened in the intrapsychic sphere by these tensions and conflicts, the same way that a society is being driven by its conflicts and by its tensions.
Yes, please.
The TRC didn't only listen to victims, but also to perpetrators. And as far as I know, they were promised amnesty for giving testimony. Is there any analogy in your conception?
I think that many of us who are working actively in psychotherapy in traumatic patients, we know these perpetrators' parts in our patients, even if they are victims. These are these parts that are evoked through discussions about issues such as guilt, and they are extremely important in such a process. I agree with you. Yes,
Michèle?
Yes, can you please give us some little more information about the fragmentation of the stereotype discourses connected with multiple themselves? When you just say that and you go on, and it is very fundamental here in our discussion.
I must say that I'm far away from being an expert in this area, especially when such important people are sitting and giving lectures about this. I will tell something from the clinical point of view. I think that when we are engaging with different selves of the patient, we can hear tremendously different stories about the same event from the same person, and this depends upon which self is now speaking.
Mm-hmm. Yes, the difference is not the same as fragmentation. So when you speak about fragmentation, do you mean just different story, or do you mean some kind of speech which is fragmented and which is fragmentation?
I mean different stories. We think, I will transfer it to our Brombergian jargon. We think about this as dissociated persons or patients, and you can get totally another story from each dissociated part of the patient, and this story has its own sets of fears, hopes, dreads, and etc. And therefore, totally another narrative.
Do you have sometimes one self who come in the middle of the story of?
Just as in society, I think, yes. They are interrelating to each other.
Yeah. Jeff?
I have a question about the kind of transfer use of the TRC model to the individual, which is not just a social model to an individual, but it's very much a political model. And it's very much all about kind of political choices and establishing a political dialogue And so transferring that to an individual kind of makes me wonder, first of all, how are the political dimensions of that maintained, and what would a kind of political dialogue within the individual be then? Which seems very different to me than something of trying to get multiple selves to talk to each other.
I would say that what we are trying to transfer is not the entire corpus of theory and practice of TRC, but rather some element of it, or I would say something about the way it is done. Or, for example, the shift from models of persecuting to models of reconciliation is something that we transfer. It is very true, because TRC models are loaded with politics, which is extremely intricate and very difficult to open, and many times it is subconscious. It is not being spoken about. We are trying to avoid these things, although I'm sure that in many facets there are also different politics of the patient and the therapist, and the different politics of the patient himself, which are evident in this process. So for sure this interferes with the process.
And our last one. Yeah, please.
I just wanted to piggyback on what Jeff asked you, which is, I'm a relational psychotherapist, and so I'm listening for multiple selves and trying to cultivate an atmosphere where conflict can be framed in that way. But I get it's fascinating, but what does it look like? I mean, how is it any different than being a relational therapist or analyst and asking the patient, talking to your patient or talking to the person? How does the truth and reconciliation model look different? Do you know what I mean? I mean, I guess I'm wondering what that actually looks like fleshed out.
You mean technically? You mean technically, or?
Technically or spiritually?
Yeah, actually, it's a technical
I think that for me, thinking about the patient, about the traumatized patient, as someone who lost the ability of different part of himself or herself to speak with each other, and this target of reconciliation, not fighting, not accentuating the conflict, but somehow accepting and absorbing this multiplicity without being at the constant need to reach a point in which someone is more powerful. I think for me as a therapist, it made a huge difference. And by the way, I'm sure that you're familiar with Bromberg and Aaron about their writings. They're reaching very similar conclusions, their work. I agree with you. In many terms, this is just in order to accentuate this. But
Thank you very much, Dr. Shlomo Mendlovic.